Good morning. Today we'll talk about oral mucosa, part 1. Oral epithelium. What do we mean by oral epithelium? Oral epithelium forms the surfaces of the oral mucosa that forms a barrier between the oral environment and the deeper tissues. It is derived from the embryonic ectoderm. It is stratified squamous epithelium and may or may not be keratinized. Beneath the epithelium lies the connective tissue. So the oral mucosa is the epithelium which lines the oral cavity. On the external surface we have the skin covering our body. Inside the oral cavity we call it oral mucosa. What are the classifications of oral mucosa? It can be classified according to the function it serves as masticatory mucosa, lining mucosa, and specialized mucosa, or can be classified according to keratinization, orthokeratinized, parakeratinized, or non-keratinized oral mucosa. It may be divided according to location: buccal mucosa, lingual mucosa, palatal, labial, and alveolar mucosa. The oral epithelium is composed of stratified squamous epithelium, which can be either keratinized or non-keratinized. The keratinized either ortho or parakeratinized. Also we have basement membrane or basal lamina separating the oral epithelium from the underlying tissue, which is the lamina propria. The lamina propria is divided into two parts, papillary and reticular, and then we have the submucosa, which contains glands or fat cells, which may be or may not be present. The layers of the keratinized epithelium are basal cell layer, Merkel cell layer, granular layer, and cornified layer. This is a diagram of the oral mucosa. We have the lining of the oral cavity, which is epithelium, as we said earlier. It is composed of epithelium, stratified squamous epithelium. Then I have the lamina propria, and then I have the submucosa. These projections from the epithelium inside, which looks like finger projections, we call them retiridges or retipegs. The lamina propria is divided into two parts, papillary and reticular, which runs between the retiridges. This part of the lamina propria, we call it the papillary, and this part we call it the reticular. The difference between the two is that the papillary is loose connective tissue with collagen fibers are at right angle to the surface, while the reticular layer, it is dense and the collagen fibers are horizontal. Here we have sections for the two types, the keratinized and the non-keratinized oral epithelium. The image on the left, we see the keratinized epithelium, and on the right we see the non-keratinized epithelium. The layers of the keratinized epithelium and the non-keratinized epithelium as seen in this histological sections are as follow. At first we have the basal cell layer, single layer. The cells are cuboidal with large nucleus that is deeply stained. Then I have few layers where the cell become polygonal and the nucleus is round. We call it the Merkel cell layer. Then we have few layers, 3 to 4 layers, with the nucleus is flat and the cell is flat. We call it the granular layer, and it is rich with the granules. We call them keratohyaline granules, and the superficial layer is the keratinized layer, which is filled with keratin. This image we see it in the orthokeratinized type. In the parakeratinized, the last layer, which is the keratinized, we see some retained nuclei in the keratinized layer. In the non-keratinized epithelial, the first two layers are the same. We have the basal cell layer and the Merkel cell layer, but the last two layers are different. The last two layers, the first one we call it intermediate layer, and I have the superficial layer. We count 2 to 3 layers. We consider them to be the superficial layers. The Merkel cell layer, the nucleus is round and the cell is polygonal, while in the intermediate layer the cell is flat and the nucleus also is flat. The same is in the superficial layer. There are other names for the layers of the epithelium, which are Latin names for the different layers of the epithelium. The first layer, which is the basal cell layer, it is called the stratum basale. The prickle cell layer, we call it stratum spinosum, and the granular layer, we call it stratum granulosum, and the keratinized layer, we call it stratum corneum. For the non-keratinized epithelium, stratum basale, stratum spinosum, and for the intermediate layer we call stratum intermedium, and the superficial we call it stratum superficiale. In these layers, the least developed layer is the basal cell layer. The least developed is the basal cell layer, and the first layer of the prickle cell layer. These are the least developed, and the most developed layer is the keratinized layer or the superficial layer for the non-keratinized epithelium. For the basal cell layer, it has another name. We call it the stratum germinativum. Why it is called that? Because this layer which undergoes mitosis, the division. That's why it stands deeper or darker than the other layers, because it has the double content of the DNA. That's why we see it more deeper in color than the other layers. This image is for the non-keratinized epithelium. We have the basal cell layer, prickle cell layer, intermediate and superficial layer. This is a diagram for the epithelium, lamina propria, and oral and the submucosa. As we said earlier, the submucosa, we see glands and fat tissue. In some areas of the oral cavity, submucosa is not present. Which means that we have only epithelium and lamina propria attached directly either to bone or a muscle. In the case of bone, we call it mucoperiosteum. This is another diagram for the different layers of the epithelium in both keratinized and non-keratinized epithelium. The basal cell layer, the cell is cuboidal, and the nucleus is rounded. And the prickle cell layer, the cell is polygonal in shape, the nucleus is round, and we have multiple hemidesmosomes on the surface of. And the granular layer, the nucleus is flat, and the cell is flat, and it is rich with keratohyaline granules, and at last I have the keratin layer. For the non-keratinized epithelium, the basal and the prickle is the same. Then I have the intermediate layer and the superficial layer. As we said earlier, the projections of the epithelium, which looks like finger-like projections, we call them rete ridges or rete pegs. Opposing to them from the connective tissue, we call it connective tissue papillae. Between the epithelium and the connective tissue, we have the basement membrane. In light microscope and in electron microscope, we call it basal lamina. A refers to the epithelium. In this case, it is keratinized epithelium, and B refers for the lamina propria, and specifically the papillary layer of the lamina propria. In this image, we can see the different layers of the epithelium. In this case, it is keratinized epithelium, and look that the basal cell layer is deeply stained, and I have here the connective tissue papillae, and these are the rete ridges. And the prickle cell layer, you can see the nucleus is round. It is easy to be defined. Here the cells becomes flat and the nucleus is becoming flat. This is the granular layer, and here I have the superficial layer, the last layer, which is the keratinized layer, and as in this case it is keratinized epithelium. Why it is called stratum spinosum? Because during preparation, shrinkage to the cells, the hemidesmosomes looks like spines over the cell. That's why we call it stratum spinosum. We look at this image. It is an electron microscope. You can see the hemidesmosomes. They are looking like spines over the cell. In this image, which are the layers that we can identify? We can identify epithelium. In this case, as you can see the keratin layer here, it is keratinized epithelium. Which type of keratinization? It is orthokeratinized, because we cannot see retained nuclei in this keratin layer. we can identify the red ridges, we can identify the particular layer of the lamina propria and the papillary layer of the lamina propria between the red ridges. The basal cell layer, which is the deeply stained layer, and here I can see the polygonal cells with rounded nuclei, the prickle cell layer, and here I can see the flat cells with their nuclei, which is the granular layer. In this image we can see the last layer. In the case of parakeratinized epithelium, you can see the keratin with retained nuclei. The cells or the epithelial cells of the oral cavity are called keratinocytes in both the keratinized and the non-keratinized epithelium. Why they are called keratinocytes? Because they have the ability to produce keratin. In the case of non-keratinized epithelium, if there is a reason or something affecting the tissues or the epithelial tissue, the superficial layer starts to produce keratin. That's why we call them keratinocytes. In some areas of the oral cavity of the lining mucosa, when are subjected to trauma or friction for a long period, the cells start to produce keratin in order to protect the underlying tissue. That's why we call the epithelial cells of the oral cavity keratinocytes, because despite they are not producing keratin, but they have the ability to produce keratin. Which type of epithelium we can see here? It is easy to identify. It is the non-keratinized epithelium. Always look at the last layer. Look at the last layers. In this case, we cannot see keratin. So this is non-keratinized epithelium. Which layers that you can identify? The basal cell layer, which are deeply stained cells, the darker ones. Single layer, cuboidal cells. Then the cells with the rounded nuclei, polygonal in shape, are the prickle cell layer. Then I have flat cells with flat nuclei, the intermediate. And the last layers are the superficial. Count 1, 2, 3 layers and consider these as the superficial layers. And below them I have the intermediate layer. The time taken for a progenitor cell to pass through the entire epithelial thickness and reaches the surface, it differs in the human body. For example, for the skin, it takes 52 to 75 days to replace the epithelium. For the guts, 4 to 14 days, gingiva 41 to 57, cheeks 25 days, and junctional epithelium every 5 to 6 days. The whole thickness of the epithelium is replaced, which means that there will be shedding of the outer layer and replaced by the next layer. Stratum basale. What are the characteristics of these cells? The cells, as we said, the cells of the stratum basale are cuboidal or locolaminar and form single layer resting in the basal lamina, and the basal lamina is at the interface of the epithelium and the lamina propria. Epithelial cells of the oral cavity are in a constant state of renewal, and the basal cells show the maximum mitotic activity. That's why we call them stratum germinativum. For the stratum spinosum, several cell thicks. They are shaped like polyhedron with short cytoplasmic processes. And the stratum basale and the first layer of the stratum spinosum are referred to as stratum germinativum, because these cells give rise to a new epithelial cells. The granulosum. The cells of the stratum granulosum are flat and are found in layers of 3 to 5 cell thick, and this layer is prominent in keratinized epithelium and absent in the non-keratinized epithelium. And these cells have keratohyaline granules in their cytoplasm. The keratinohyaline granules help to form the matrix of the keratin fibers found in the superficial layer. The stratum corneum Cells of the stratum corneum are flat, devoid of nuclei, and full of keratin filaments surrounded by matrix. And these cells are continuously being sloughed and replaced by epithelial cells that migrate from the underlying layers. The non-keratinized oral epithelium, non-keratinized epithelial cells in the superficial layer do not have keratin filaments in their cytoplasm, and the surface cells also have a nuclei, and the stratum corneum and the stratum granulosum layers are absent. The epithelial is associated with lining of the oral cavity. So we see the non-keratinized epithelium in the lining mucosa. Non-keratinocytes. What we understand from this name, non-keratinocytes, meaning that the cells that we will study are not the epithelial cells, and these cells do not have the ability to produce keratin. When they examined the epithelium of the oral cavity under light microscope, they saw some areas are clear. They do not stain with the eosin and hematoxylin, and they need special staining to see them. That's why we call them non-keratinocyte, or another name, clear cell. That's why they are called clear cell, because they look clear, white in the sections. They do not stain by the eosin and the hematoxylin staining. In the image in front of us, which type of epithelium? It is keratinized epithelium. As you can see, the last layer, it is keratin. Here I have two nuclei retained, but these two nuclei not judge that the whole section is parakeratinized. For the whole section to be parakeratinized, we must see more retained nuclei in this section. So this image is for non-keratinized epithelium, specifically orthokeratinized epithelium. So going back, what are the cells that do not stain in the eosin and hematoxylin staining, which are called the clear cells or non-keratinocytes? They do not have the ability to produce keratin. They have other functions. These are the non-keratinocytes that are seen in the epithelium tissue. At first, we have the Langerhans cells, which are dendritic cells, antigen or immunocompetent cells. Merkel cells are touch receptors or mechanoreceptors. Melanocytes, melanin producing cells, and inflammatory cells. This is the oral epithelium, and these are the different layers of the oral epithelium, the keratinized epithelium. These are the three types of cells that we can see. We can see the Langerhans cells, the immunocompetent cell. We can see the melanocyte, melanin producing cell, and we can see the Merkel cell, which is the mechanoreceptor cell. As you can see here, that two of the three types are seen in the basal cell layer, which are the melanocytes and the Merkel cell. We see them in the basal cell layer. The Langerhans cell, we can see it in the basal and in the brachial cell layer. It is movable cell. The origin of the cells also is different. The melanocytes and the Merkel cells are originated from the neural crest cells, while the Langerhans cell is a hematopoietic origin, have a hematopoietic origin. The melanocytes are in contact with the keratinocytes. Each melanocyte is in contact about 30 to 40 keratinocytes, and the keratinocytes are the cells which are responsible for the degradation of the melanin. This image for the melanocytes, it is large multidendritic cell, Cytoplasm is rich with melanosomes, and it is in contact with the keratinocytes, which are responsible for the degradation of the melanin, which gives the color of the skin and the color of the oral mucosa. Large multidendritic cell. Here I can see the concentration of the melanin in the oral mucosa on the epithelium of the gingiva, and here also I can see it in this image. If the melanin leaked to the underlying connective tissue, the cells of the connective tissue cannot degrade this melanin, so it will stagnate there. That's why in this case we call it melanin incontinence or racial pigmentation. Here I have the epithelium, the keratinocytes. If the melanin leak to the underlying connective tissue, the cells of the connective tissue will not be able to degrade this melanin, so it will stagnate there. That's what we call it melanin incontinence. The second type of the cells that are non-keratinocytes are the Langerhans cells, immunocompetent cells or antigen-presenting cells. The cells or Langerhans cells are large, multidendritic cells, deeply invaginated nucleus. Cytoplasm is rich with rod-like structures. We call it Purpuric granules. We call them Purpuric granules. The function of these Purpuric granules is unknown. Large, multi-dendritic cell, deeply invaginated nucleus. Cytoplasm is rich with rod-like structures called Purpuric granules. The function of the Purpuric granules is unknown, and it is responsible for presenting the antigen to the T lymphocytes. Third type is the Merkel cell, large cell, multiple invaginated nuclei. Cytoplasm is rich with neurotransmitters and its contact with nerve axons because it is for pressure, or it is a mechanoreceptor. You can see in the nucleus structure like a wheel. We call it nuclear rodlet. The function is unknown. Moving to the lamina propria, as we said, the epithelium, I have the rete ridges. Below the epithelium, I have the lamina propria, which is two parts: the papillary, the one who goes between the rete ridges, and the reticular. The papillary is loose, with the collagen fibers are at right angle to the surface, while the reticular is dense and the collagen fibers are parallel to the surface. Here I can see the epithelium, the lamina propria, the rete ridges, and the papillary and the reticular layer. And below the lamina propria I can see the submucosa, where I can see here the minor salivary glands. Between the epithelium and the connective tissue, the interface, we call it basement membrane in light microscope, and in electron microscope we call it basal lamina. And the basement membrane or basal lamina is composed of two parts: lamina lucida and lamina densa. Lucida because it looks light here, it looks lighter in color. You can see here it is light in color. This is the lamina lucida. The darker one is the lamina densa. Lamina lucida is composed of laminin and collagen type 4, while the lamina densa is composed of collagen type 4. Also, you can see anchoring fibrils of collagen type 7, and between the anchoring fibrils we can see the collagen of the underlying layer. These anchoring fibrils, like hooks, helps to bind the lamina densa with the underlying tissue. And also we can see the hemidesmosomes from the epithelial cells. Epithelial in the connective tissue, if we take out the epithelium from the connective tissue, how it looks like. This is an electron microscope. Here I can see these are the rete ridges. These are the rete ridges. And here are the holes where the rete ridges goes. Between I have the papillary layer of the connective tissue. Subdivisions of the oral mucosa. If we look at the oral cavity, these are the different landmarks that we can see. We can see the frenum, the lips, the hard palate, the soft palate, the uvula, the tongue, the teeth, the gingiva, the lips, the cheeks. These are anatomical landmarks. The oral mucosa can be divided into, as we said earlier, into masticatory mucosa, specialized mucosa, and lining mucosa. Masticatory mucosa, we can see it in two places: the hard palate and the gingiva. Free and attached gingiva plus the hard palate is of a masticatory type mucosa, which is keratinized, which has a keratinized epithelium. The lining mucosa is non-keratinized epithelium. In between I have the specialized mucosa. The specialized mucosa, we can see it in four places. Place number 1, the lingual tonsils. Number 2, the junctional epithelium. Number 3, the anterior 2/3 of the tongue. And number 4, the vermilion border. Two of these are keratinized and the other two are non-keratinized. The junction epithelium and the lingual tonsils are non-keratinized, while the anterior two-thirds of the tongue and the vermilion border are keratinized. Removing the palate and the gingiva and the 4 specialized mucosa, all the remaining inside the cavity will be of the lining mucosa, non-keratinized epithelium. Oral mucosa, as we said earlier, I have lining mucosa for 60%, masticatory 25%, and the specialized 15% of the oral mucosa. At first, we will see the masticatory mucosa. The masticatory mucosa is the gingiva, is masticatory, free and attached, and number 2, the hard palate, the roof of the oral cavity. The hard part, the non-movable part, the posterior part of the palate is soft palate. We call it soft palate because it is movable. So this is the hard palate. And the hard palate is divided into 4 regions. The midline region of the palate, the rugae area, the anterior folded area, and then I have anterolateral side and posterolateral side of the hard palate. What are the differences between these areas? In the midline area, I have a keratinized epithelium with lamina propria, but I don't have a submucosa. It is firmly attached to the underlying bone, no submucosa. In the anterior lateral part of the hard palate, I have submucosa, and the submucosa is rich with fat tissue. The posterior lateral part of the hard palate, I have submucosa, and it is rich with glands, minor salivary glands. So if I have a section in the midline region of the palate, I will see only epithelium and lamina propria. If the section is in the anterior lateral part of the hard palate, I will see epithelium, lamina propria, and submucosa rich with fat tissue. In the posterior lateral, I will see epithelium, lamina propria, submucosa rich with minor salivary glands. Here I have cross section, coronal section. Look at the mid region of the hard palate, epithelium, lamina propria, and bone. On the lateral sides, here I can see the glandular tissue, the submucosa rich with glands, minor salivary glands. If the section in the anterior lateral part of the hard palate, the midline, no submucosa, lateral sides rich with fat tissue. Here is a sagittal section of the hard palate in the midline region. The hard palate and the soft palate. Masticatory mucosa, as we said earlier, we have 2 areas, keratinized epithelium, gingiva, and hard palate. How to differentiate the section in front of me is for a gingiva or for a hard palate. Look at the written ridges. If the written ridges are finger-like projections like this, it will be gingiva. If the written ridges are square in shape, so the section is taken from the hard palate. Look at the written ridges here, they are almost square in shape, not finger-like projection. So this section is taken from the hard palate. In the hard palate, from which region? Look, is there a submucosa or not? I have here the epithelium, I have the lamina propria, then I have bone, no submucosa. So this section is taken from the midline area of the hard palate. Here, look at the written ridges, the finger-like projections on the image. This image is from the gingiva, and here the written ridges are square in shape, which means that this is taken from the palate. So depending on the shape of the written ridges, you can judge whether the section is taken from the epithelium of the gingiva or it is from the hard palate. Look at this image. You can see here the keratinized epithelium, and you can see the form of the ridges, which is square in shape. So this section is taken from the palate. As we said earlier, we have the midline area, anterior lateral fatty, the posterior lateral is glandular. The hard palate, you can see here, I have the epithelium with its ridges, which is square in shape, the lamina propria. Then I have submucosa. Which type of tissue here in the submucosa? Look, these structures are minor salivary gland. You can see hiziness inside, not clear white. If it was clear white, it will be fatty tissue, but this is the shape of the salivary gland, typical for salivary glands, minor salivary glands. So this section is taken from the posterior lateral part of the hard palate. Look at this image. You can see the ridge is square in shape. I have the lamina propria, almost the epithelium, and the lamina propria. The lamina propria have the same thickness of the epithelium or slightly higher. Then I have submucosa. Look at these clear areas, clear white, soap bubble appearance. This is a fat tissue. So the submucosa is rich with fat tissue. This section is taken from the anterior lateral part of the hard palate. And here you can see the blood vessels. Here you can see the difference between the glandular tissue and the fat tissue. In the fat tissue, clear white, soap bubble appearance. While in the gland tissue, you can see like bubbles, but the inside there is a hiziness. More darker in color. How to differentiate between the glandular tissue and the fatty tissue. The hard palate separates the oral cavity from the nasal cavity. In the oral cavity, I have the hard palate covered with the oral mucosa, lining epithelium, stratified squamous epithelium. In the nasal cavity, I have a respiratory epithelium, pseudo-stratified columnar ciliated epithelium. You can see the cilia here with goblet cells in between. This epithelium, so it is a respiratory epithelium. So this image or this section is taken from the hard palate from the nasal part. How to judge is it an oral part or a nasal part? Look at the surface of the epithelium. You can see here there is no keratin, and the last layer I have cilia on the cells, which means this is a respiratory epithelium, and in between these clear spaces are the goblet cells. Then I have the lamina propria. Then I have the submucosa, and in this case it is rich with mucous glands. These mucous glands, we call them Bowman's glands. Bowman's glands, mucus secreting glands. Here I can see a large blood vessel. So as we said earlier, I have an oral cavity lined with oral mucosa, oral epithelium, keratinized epithelium, while the upper part is the nasal cavity, and it is lined with respiratory epithelium, pseudo-stratified columnar ciliated epithelial cells. As you can see here, here we are pointing to the goblet cells, and here I can see the epithelial cells with the cilia. The specialized mucosa. The specialized mucosa, as we said earlier, it covers 15% of the oral cavity, and it is found on 4 places: the vermilion border, the anterior 2/3 of the tongue, also on the lingual tonsils and the junctional epithelium. For the lingual tonsils and junctional epithelium, we will study them next week. In this week, we'll talk about the vermilion border and the anterior 2/3 of the tongue. Here I have the specialized epithelium on the anterior 2/3 of the tongue. It is covered with papillae, different types of the papillae. The dominant one is the filiform papillae, which are keratinized. Epithelium helps in mastication. Here is the shape of the filiform papillae, which covers the surface or the dorsum of the surface of the tongue. These are the filiform papillae. Between the hard palate and the soft palate, you can see the difference between the keratinized epithelium to non-keratinized epithelium, which is the soft palate. Here I can see the gingiva. This is the oral epithelium, the gingiva, keratinized epithelium. You can see the ridge is finger-like. Then I have the lamina propria, and in the gingiva there is no submucosa in the gingiva. Here I can see one type of the specialized, which we call it the junctional epithelium. This area, this epithelium that binds the gingiva to the enamel of the tooth, This layer we call it the junctional epithelium, one of the 4 specialized layers in the oral cavity. Which type of mucosa? As you can see, it is non-keratinized epithelium. Why it is not keratinized? Look at the last layer here. I can see the basal, the prickle, and then I have the intermediate and the superficial, no keratin layer, so it will be what? It will be a lining mucosa. We can see the lining mucosa in everywhere in the mouth because it comprises for 60% of the oral mucosa. As we said earlier, the cheeks, the floor of the mouth, the ventral surface of the tongue, the inner surface of the lips is the lining mucosa. Here I can see the vermilion border. The vermilion border, or we call it the red zone, it is a transitional zone between the outer skin and the inner oral mucosa. This transition layer, this is the vermilion border, one of the specialized 4 places in the oral cavity, one of the 4 keratinized layers. The keratinized are the tongue and the vermilion border, or the red zone, or also called transitional zone, because we have the skin, the transitional zone, then I have the oral mucosa. The skin is keratinized epithelium, the vermilion border keratinized, the oral mucosa non-keratinized epithelium. How can we differentiate between the skin and the oral epithelium or oral mucosa? What differentiates the skin from the oral mucosa is the presence of the skin appendages in the skin. What are the skin appendages? We have hair follicles, sweaty glands, and sebaceous glands. These are the skin appendages. This is a sagittal section of the lip. I have a skin part. Here I have a skin part. I have an oral mucosa part, non-keratinized epithelium. The area in between, the transitional area, this is the vermilion border or the red zone. In the oral cavity, the oral mucosa, I can see the epithelium, lamina propria, and the submucosa rich with minor salivary glands. While on the skin part of the lip, I can see the epithelium with the keratin on the surface, lamina propria. The submucosa, here I can see hair follicles, sweat glands, and sebaceous glands. The vermilion border is transitional area. Transitional area, more reddish in color, that's why it's called the red zone. And I cannot see the skin appendages in this area. So no skin appendages with the keratinized epithelium, no salivary glands. Here is the vermilion border. The submucosa, then below it I have a muscle. The muscle in the lip is called the orbicularis oris. So epithelium, labia propria, submucosa connected to muscle. Which muscle? It is an orbicularis oris in the lips. In the cheeks, I have epithelium, lamina propria, and a muscle, and the muscle in the lip is the vaccinator. Here is another view for the skin part, A, skin part of the lip, C, the oral mucosa, and B for the vermilion border. D here refers to the minor salivary glands in the near the oral part. And here I can see the skin appendages. This is a diagram for the labial mucosa or lining epithelium. We can see the minor salivary glands. And on the skin part, we can see the hair follicles with the sebaceous glands. And this is the transitional zone, the vermilion border or the red zone. And the muscle is the skeletal muscle orbicularis oris. You can see the difference. This is the oral mucosa from the cheek, the submucosa, the epithelium, the lamina propria, the submucosa, and the muscle of the cheeks is the vaccinator. On the skin, you can see here the hair follicles, the sebaceous glands. Here is the hair shafts. This is another diagram for the skin. You can see here the hair shaft. You can see the sebaceous glands, and you can see the sweat glands. What you can see in this image, yes, A, sweat gland, C, hair shaft, and B, spacious gland. Here, what you can see, keratinized epithelium, and this is the spacious gland, and here I can see the hair follicles. You can see here the vermilion border, keratinized epithelium, B, the oral epithelium, oral mucosa, thick non-keratinized epithelium. Here, C refers to the muscle of the lip, which is the orbicularis oris. Here you can see the vermilion border, the keratinized epithelium, and here the muscle, the orbicularis oris. You can see the transition between this area to this area. Thick non-keratinized epithelium, thin keratinized epithelium, vermilion border, and the labial mucosa. Here what you can identify muscle tissue. You can identify minor salivary gland in the lamina propria. In the submucosa, this is the lamina propria, and the epithelium here is non-keratinized epithelium. So this is the labial mucosa, how it looks like, non-keratinized epithelium, lamina propria, and the submucosa is rich with minor salivary glands. Yes, what are the layers you can see here? Correct. A, basal cell layer. B, Merkel cell layer, you can see the rounded nuclei. The last layer, flat cells, intermediate and superficial. And C here refers to the what? Yes, oral cavity. As we said earlier, why we call them keratinocytes? Because they have the ability to produce keratin. Here you can see the cheeks. Here is the area in the cheek. The mucosa of the epithelium, or the mucosa of the cheek, is of non-keratinized epithelium, lining mucosa. This linear area, which follows the shape or the form of the bite between the upper and lower teeth, is keratinized area. So why this area is keratinized? Because due to trauma by biting, in this case we call it cheek biting. So to protect the underlying structures, the keratinocytes start to produce keratin in this area. That's why it is light in color or white in color. In this case, we call it cheek biting. This form on the cheek is called Linea alba baccalis. We call it Linea alba baccalis. Linea because it is linear, alba because it is white in color, baccalis because it is in the cheek. This is due to cheek biting. Also, if I have, for example, a tooth here which has a sharp filling or has a fracture, sharp point, during friction with the oral mucosa, there will be a keratin layer here will develop to protect the underlying soft tissue. This image you can see here, this section was in the area of the linea alba baccalis. The epithelium, non-lining mucosa, basal, brachial, intermediate, and superficial. You can see here the layer of the keratin over the underlying layers. So the last layers start to produce keratin in order to protect the underlying tissues. This is at the area of the linea alba baccalis. On the cheeks, we sometimes see yellow spots either near the angle of the mouth or the lips or on the sides of the cheek, yellow spots. These we call them fordyces spots or fordyces granules, and these granules are ectopic spacious gland. Ectopic means that they are normal structure but found in not their normal place. The spacious glands are seen on the skin, but inside the oral cavity we call them fordyces spots or fordyces granules. They look yellowish in color. If we take a histological section, it will look like this is the histology for the fordyces spots of the granule, the form of the spacious glands seen inside the oral cavity. Thank you. I hope you enjoyed my session. See you next week.